Sudden, severe chest or back pain, often described as tearing or ripping, is a key indicator. This pain may radiate to the neck, jaw, or down the back, indicating potential aortic dissection. Aortic dissection involves the separation of the aorta's layers, causing intense pain and compromised blood flow. Shortness of breath occurs when the aorta presses on the lungs, reducing lung capacity. Aortic valve problems can strain the heart, leading to breathing difficulties. Breathing difficulty may worsen when lying flat due to increased pressure on the lungs and heart. Hoarseness, cough, or difficulty swallowing can occur when an enlarged aorta presses on the throat, vocal cords, or esophagus. Pressure from an enlarged aorta can alter voice quality, leading to hoarseness. An enlarged aorta can trigger a persistent cough and make swallowing difficult by physically obstructing the throat and esophagus.